Hey guys, Josh and David here with Republic Pain Specialists. We're having a little chit chat this morning, talking about specifically about fibromyalgia. It, it's something that it carries this horrible stigma with it, unfortunately, and I think it's something that is so widespread and so unknown. There's so much misinformation about it. There's so much, especially in the medical community. Doctors and providers, and it's almost become a diagnosis of exclusion. You hurt, you've got pain, widespread pain all over. They image it, they X-ray it, they MRI it. They can't find any actual physical pathology there, and so the next thing as well is this in your head. This has to be in your head. We've X-rayed everything, we've MRI'd everything, we've done a physical exam. There's nothing really physically wrong. So, it's got to be made up. It's got to be something that doesn't exist. And
yeah. You and I both for years. I spent 22 years in the OR doing anesthesia. I forget now, 10 years or so. Yeah. Just a long. Every time a patient came in, and they needed a knee replacement, or they were getting their gallbladder taken out, and you look on their history and it says fibromyalgia, and I'm just being totally honest with y'all out there in the world. Most of us would go, oh my God.
Yeah.
But what we saw was that there wasn't. We didn't know a reason. No one could find a reason why they hurt. But they were definitely a chronic pain patient.
Absolutely.
They were definitely had centralization. They were definitely ramped up. They'd been on opioids and all these drugs for years. We knew from an anesthesia standpoint, this has got to be a tough case to manage their pain.
And most of the times, you never could manage their
pain.
And
you almost couldn't control it. It was just one of the most difficult cases from an anesthetic standpoint of how do you manage this patient's post-op pain. They can't manage their pain at home.
Yeah.
Now we're going to load them up. Now we're going to ramp that pain level up, and to the nth degree. It was just such a difficult case. You jump forward to a fellowship, you start working with these patients, and you gain more knowledge, and you find out this is not made up. It's not a psychological disease. It has criteria now. It has medical diagnosis. It has testing to prove that something's going on from an inflammatory standpoint. Okay. So even knowing that, historically, fibromyalgia, we didn't have an injection. We didn't have like, okay, if I send you to physical therapy, you'll get better.
Yeah.
If we put you on this drug regimen, you'll see improvement.
Yeah.
Quite honestly,
there's no treatment.
There was almost, we treated, but we didn't really see very good results. We didn't treat well.
No. We
weren't seeing good results with them. And I got to tell you a story. This is our case studies thing, series. So I got to tell a story that totally. It really blew my mind, but it was the kind of sentinel moment in a practice, in an experience level, treating people, that changed my mind about what can be done for fibromyalgia. So I had read some studies. Obviously, we do a lot of stellate ganglion blocks, sympathetic nerve blocks for long COVID. We started seeing that the long COVID patients, a lot of them came in with previous histories of fibromyalgia. We do the sympathetic block for their long COVID symptoms, suddenly their fibromyalgia pain gets better. I started getting really curious about that, and we had a patient call. She had been diagnosed with fibro probably 30-something years prior. As the years went by, the pain progressed to the point where she had become disabled, and she was a teacher. She was a very intelligent woman, very put together, very classy lady, and the fibro and the pain had become totally debilitating, almost homebound.
Yeah.
Even though she worked hard, she did water aerobics, she did the exercises, she took the meds, she did everything she could to try to control it, meditations, she did everything she thought she could. She came in and I offered her a total experiment, saying, just if you just let me try, will you be open to letting me try? Not use drugs, but say try something different.
Sounds like she had tried everything at that point.
It was, and it's kind of those patients that when they're at the end of their ropes, that they will let you try an experiment.
Yeah.
So experimentally for fibro, even though we'd done lots of stellate ganglion blocks, I asked her to let me try a stellate ganglion block. We did a right-sided sympathetic nerve block, stellate ganglion block. And she just sat and bawled and cried. She was pain-free in a line down her body, unilaterally on the side of the block, within minutes. We did a left side next, and she went pain-free on the other side. Kind of give you her history. That would work for a few weeks. Her pain came back. We repeated the blocks. Her pain stayed gone for longer, 6 or 8 weeks at a time. Ultimately, after a couple of sets of blocks, we ended up doing radiofrequency ablation. We just talked about that for the knees. We did radiofrequency ablation of the sympathetic nerve, and she went over 10 months without requiring medication for her.
Huge.
She's got her life back. I mean, she has such a powerful testimony and story of how she got her life back after 30 something years of being disabled from this pain, because we did a couple of injections with lidocaine. Ultimately radiofrequency to give her long term, so she didn't have to come back every 3 months. But it's just really, and I know now you've treated. Yes, we kind of got on board doing a little study.
It's interesting, and you nailed it. They all say the same thing, that completely uncoached, and I just ask them, how do you feel? How do you feel? And they all say what you just said. They draw this imaginary line down the middle of their body, and the side that we blocked, the pain is gone. I mean, completely gone.
It's crazy.
And then we do the other side, and their pain goes away. It's not like we're taking them from a 7, 8, 9 out of 10 pain. I mean, a lot of these to a 5 or 6. Like, these folks are saying their pain is gone. And for most of them, it's the first time they haven't heard in years, because
years and years.
Very rarely do we see somebody that got diagnosed with fibromyalgia last week. It's not like this is something that these folks have been going through for years and years and years, and they have tried every single treatment, gimmick or not. They've done it all, and just to see it gives me chills just talking about it, man. Just to see the relief that comes over them. There's
nothing like it. Nothing like it. I mean,
not at all.
I love seeing the long COVID smell and taste patients get better, but this is so much more emotional to them. Sure. That they can get out of pain. I don't want to. We kind of jumped ahead and leave y'all without a little bit of knowledge of why would a sympathetic nerve block help fibromyalgia. Okay, so let's make that connection there. That fibromyalgia is an autoimmune disease. Okay, meaning autonomic system is triggering the immune system to release this widespread inflammatory response throughout the body, creating muscle pains and joint pains, headaches, everything else. But it all starts in the autonomic system. Okay, the sympathetic nerve block, the stellate ganglion block, as far as we know, as far as we can tell, especially clinically, if we block that sympathetic component of the autonomic nervous system, we create a reset of that system. We shut off, we break that cycle of autonomic immune inflammatory response. So if we break that cycle, the body stops triggering the immune system, the inflammation stops being sent out throughout the body, and almost immediately their pain goes away. So anybody out there suffering from fibro, I will beg you, I'll get on my knees and beg you, somebody try, go ask for a sympathetic nerve block. It might be so life-changing that you just it'll be worth the chance.
For sure. Just the opportunity to get better, and that's what a lot of these folks, they just want some degree of hope that maybe this isn't how I have to live the rest of my life. You know?
Exactly.
And just seeing what we've seen is, I truly think, and it's been life changing for a lot of these folks. So we're definitely going to continue doing this, and